नमस्कार। नर्सिङ लाइसेन्स एक्जामिनेसनको लागि इम्पोर्टेन्ट 20 क्वेशनहरू लिएर आएका छौँ। क्वेशन नम्बर 1 मा रहेको छ, व्हाट पर्सेन्ट अफ कार्बन डाइअक्साइड डज द एक्सपायर एयर कन्टेन भनेको छ। यसको राइट एन्सर हो 4%। क्वेशन नम्बर 2 मा छ, स्ट्यान्डर्ड डोज अफ डिपो-प्रोभेरा इज एन इन्जेक्सन अफ। यो चाहिँ डिपो-प्रोभेराको चाहिँ स्ट्यान्डर्ड डोज कति हो भनेर सोध्न खोजेको हो। यसको राइट एन्सर रहेको छ 150 mg एभ्री 3 मन्थ। 150 mg every 3 months. Question number 3 मा छ, the initial injection of सङ्गिनी should be given during the first of menstrual period भनेको छ। यसमा चाहिँ 5 days 5 days चाहिँ यसको राइट एन्सर हो। क्वेशन नम्बर 4 मा छ, what will be the best contraceptive method for non-lactating mother after delivery? non-lactating mother after delivery, यसको राइट एन्सर हो ओरल पिल्स। क्वेशन नम्बर 5, नोरोप्लान्ट इज युज्ड, राइट एन्सर हो अंडर द स्किन। अंडर द स्किन। क्वेशन नम्बर 6, द डिनोमिनेटर अफ मैटरनल मोर्टालिटी रेट इज। द डिनोमिनेटर अफ मैटरनल मोर्टालिटी रेट इज द टोटल लाइव बर्थ। टोटल लाइव बर्थ। क्वेशन नम्बर 7, द नर्स रिकग्नाइज। The nurse recognize which factor in the post-operative patient poses the greatest risk for development of pulmonary embolism and must be addressed in the patient's care plan. Must be addressed in patient care plan. Right answer हो immobility. Immobility. Question number 8. A patient has been receiving a blood transfusion for 5 minutes. The patient beginning to have chest pain and low back pain. What action should the nurse take first भनिन्छ। यो ब्लड ट्रान्सफ्युजनमा रियाक्सन देखेको हुँदा यसको चाहिँ राइट एन्सर हुन्छ स्टप द ब्लड। स्टप द ब्लड। क्वेशन नम्बर 9 मा छ, the nurse is teaching an athletic teenager about nutrient that provide the quickest source of energy. That provide the quickest source of energy. The nurse conclude that understanding has taken place when the adolescents make which selection from menu. Right answer हो glass of orange juice. Glass of orange juice. Question number 10 मा छ, because fat is insoluble in water, it cannot travel freely in the blood. Therefore, the nurse understands that the main compound formed to serve as a vehicle of transport are A को lipoprotein. Right answer हो lipoproteins. Question number 11. The care plan for the patient with paraplegia includes nursing action to prevent the formation of urinary calculi. The nurse explained to the patient the risk for urinary calculi is associated with D को accelerated bone demineralization. Accelerated bone demineralization. Question number 12. When assessing a patient with a fracture of neck or femur, which clinical indicators should the nurse expect to identify? C को shortening of the affected extremity with external rotation. Shortening of affected extremity with external rotation. Question number 13. Question number 13. When should the nurse engage the patient's schedule for an amputation in rehabilitation? When should the nurse engage the patient's schedule for an amputation in rehabilitation? Before the surgery. Before the surgery. Question number 14. When assessing a patient with Cushing syndrome, which clinical indicator can the nurse expect the patient to demonstrate? Liability of mood. Liability of mood. Question number 15. Transurethral resection prostatectomy is performed to Mr. Ramesh, 60 years old. Due to prostate enlargement, post-operatively he has continuous irrigation. Which Which of these statement explain the reason for continuous bladder irrigation? इसको राइट आंसर हो टू रिमूव क्लॉट फ्रॉम द ब्लैडर, टू रिमूव क्लॉट फ्रॉम द ब्लैडर. क्वेश्चन नंबर 16. After the removal of three-way catheter, the nurse should inform Mr. Monish that he can normally experience dribbling incontinence. Dribbling incontinence. Question number 17. Which of the following measures should you encourage Mr. Rector to do in order to regain urinary control? Right answer. Alternately tense and relax the perineal muscles. Alternately tense and relax the perineal muscles. Question number 18. When developing a teaching session on glaucoma for the community, which of the following statement would the nurse stress? Right answer. Glaucoma can be painless and vision may be lost before the person is aware of problem. Glaucoma can be painless and vision may be lost before the person is aware of problem. Question number 19. Which of the condition is an early symptoms commonly seen in myasthenia gravis? इसको राइट आंसर हो टोसिस. राइट आंसर हो टोसिस. क्वेश्चन नंबर 20. Which of the following statement best describe the Parkinson's disease? Which of the following statement best describes the Parkinson's disease? Degeneration of substantia nigra, depleting dopamine. Degeneration of substantia nigra, depleting dopamine.